Traumatic brain injury is typically any sort of trauma to your head, and that may be with loss of consciousness or without.
A traumatic brain injury happens when some type of external force hits a person's head. So that could be anything like the person is walking and they slip on the ice and they hit their head. It can be when they're in a car accident and maybe their head hits the windshield. Any of those types of situations can cause a traumatic brain injury.
An important thing to keep in mind is you might have a completely normal brain scan. Let's say you've gone into the ER and they've given you the once-over and they say, well, your scan looks good. That doesn't mean that you don't have a traumatic brain injury.
The thing is, when a person has a brain injury, that person can talk, they can walk, it seems like they're having a great conversation with you, and all those things are true. But the thing is, it's the invisible injury. You can't see the behind the scenes, what's actually really going on. That person might not remember what you said in that conversation. They might have had to use a strategy to even get to that medical appointment. I mean, there's so many things that can happen behind the scenes that you won't even know about when it comes to a brain injury. And that's why we help people, is to make those unseen difficulties actually go better for that person.
We offer a really caring, individualized approach to helping individuals be more functional in their environment, whatever that is, and whatever caused them to have difficulty in their environment is what we address.
I feel like many don't recognize that these patients that we're seeing with traumatic brain injury, it is not intentional that they're not taking their medication and they're not eating breakfast and they're not showering. You know, that happens. And it's basically due to getting back into those normals, being able to get a structure and routine, identifying how your brain can work and optimizing that, and then building these skills in the meantime so that we can see that all come together. That's really rewarding. I mean, you see people that start to feel quite poorly about themselves because I used to shower every day and now I'm too tired, I shower once a week. Well, that's embarrassing for them to share that sort of information. So we're talking very basic day-to-day skills that we're getting back in place that are really having quite a big impact.
A big piece that comes along with traumatic brain injury is disrupted sleep schedule or a loss of appetite, and all of these foundational things that need to be in place for a person to function, for their brain to function, for their body to function, and for them to continue in their recovery. So if those are disrupted and a person is having a lot of trouble getting those back in place, to have goals set and to specifically be working towards those things in a kind of moderated, sequential way is very helpful, and that's something that we do just to increase a person's routine and follow through for those kind of scheduling things to get what their body needs so we can continue with their recovery.
So when I think about therapy for brain injury, I'm not just talking about paper, pencil tasks. Those have a purpose, they help to build skills, but I'm thinking more along the lines of functional strategies that the person can use. So, for example, I'm just going to tell you some things that I've helped people with when they've had a brain injury. A big part of our therapy is to build awareness. Sometimes when a person has a brain injury, they can't see the injury. In fact, they might actually think that they are performing perfectly well. I have worked with somebody who could not see that they even had an injury, but it was very obvious to everyone around them that something was quite different. I mean, this was somebody who was not remembering to shower, they were not thinking to clip their fingernails. They really weren't doing a lot within the home to be a contributing member of the family, but yet this person thought that things were going beautifully and that there were no problems at all. So part of my role is to build that insight until you can actually see that there is an impairment and that there's something that you need to do about it to live life more effectively. You won't do that.
If you've seen one patient with brain injury, you've seen one patient with brain injury. You know, this looks very different from one person to the next. And so treating each individual and family and providing that care means no cookie cutter. All of them are requiring their specialized evaluation and specific treatment plan that matches their needs.
So many they get to a point where, you know, obviously their troubles aren't gone, but they've become really efficient with using strategies to the point where they can compensate and they no longer experience the same
struggles as they did before.
Right.
So they still have problems, but they're able to use skills to really compensate and support those things they have trouble with.
I would say there is definitely hope for people who've had a brain injury. No doubt in my mind.
Whether it's been 2 months, 2 years, or 20 years, there is definitely hope for brain injury. There are skills that you can attain that you didn't, there are skills that you can attain that maybe you don't have now. So I would encourage you to call us here at Progressive Therapy Associates, get a free consultation. We can determine what we might be able to do to help you.
So if as a family member you're recognizing some of these symptoms that we've talked about, it could be so incredibly important to give us a call at Progressive Therapy Associates and let us see what we can do to help.
So there are multiple ways that you can get the treatment you need at Progressive Therapy Associates. You can call here for a free consultation. Your provider, your medical provider, you could ask them to refer you to our clinic. You could fill out a form on our website, and that could help you to initiate the treatment you're needing here.
So if you're wondering if our services could be of help to you, just give us a call. We will help you to figure out if what we provide is a match, and we'll let you know if it isn't.
Progressive